Hello, I'm Dr. Joanne Baldwin-Peters, and together with Dr. Joel Funk and Court Brooker, we put together an online, unfunded sexuality survey examining the effects after treatment of prostate cancer. Well, we sort of looked at the diagnosis of prostate cancer. For most people, this is fear, total and utter, unmitigated fear. Then people calm down, and the next question is, what sort of treatment should I have? Well, this raises the secondary fear, erectile dysfunction from some of the treatments, in fact from all of the treatments in some form or other. Everyone calls it ED, and I'll call it ED from now on. So, how did our survey people deal with these fears? Well, first of all, the survey consisted of 449 prostate cancer survivors and 193 partners. And this total group of 641 people came up with some very interesting answers. Examining our data carefully, we found that 50% of the men had prostatectomies in some form or the other, and 29% of the men had radiation. Before treatment, only 6% of men were not having any sex, but after treatment, a whopping 46% were not having sex. And initially, 43% of the men, prostate cancer survivors, reported having sex once or more per week, and after treatment it dropped to 18%. Examining the men's report, those who had radical prostatectomies were unable to have sex or an erectile function immediately after treatment. But some of them, several of them actually, were getting return of erectile function, but it may take as long as 3 years. And during this period, if the penile tissue is not exercised, there are problems. So it is advised to maintain some sort of stimulation to the penile tissue. On the other hand, the men with radiation slowly had decreasing erectile function over the years. And we're not 100% sure whether this was due to aging problem or something else, and it needs much further study. Well, we threw in an unexpected question in the survey and asked people how important having an orgasm was. We were quite amazed that 92% of the study group of 641 people, men and their partners, felt it was very important. And this is unusual because the average age was 64, and at this age there's an expectancy by everyone who knows anything about sexuality, which is probably very little, that sexuality decreases in the 60s and 70s, but this would not appear to be so. The first line of treatments usually are medication, pills in the form of Viagra or Cialis, penile shots, penile pumps, penile implants, and this should solve the problem. But unfortunately, 62% of our study group did not achieve an erection that was sufficient for penetrative sex. Very disappointing. It is possible to have an orgasm without penetration and without ejaculation. So this leaves a vast scope of things that people can do. We asked our study group, and this is the way they came up with. Topping the list was masturbation, followed by mutual masturbation, followed by penile shots, then oral sex, sex toys and videos, such as vibrators and videos, penile implants, and at the very bottom, medication. and probably medication has to be pre-planned. The others are spontaneous, so it's easier. I guess it boils down to one thing in the end: our own personal beliefs. Our own personal beliefs and comfort zones within the sexual field, within our hang-ups about sex, and we need to reach a level of comfort. We need to reach a level that accepts no shame or blame, and until we do this, we won't be successful in achieving our goals. You might want to learn a little bit more about things that you can do to help your journey with prostate cancer and survivorship. And we do have the survey online on a website, and we have a book that we published. It will give you all the details that you need to help you along your journey. Thank you.